Welcome back in. Parents of kids with special needs were at the Statehouse today, and it's not their first visit. It's part of an ongoing protest to propose cuts by the Family and Social Services Administration.
So these cuts, families say, would impact the care that they can give their children. 13 News reporter Emily Longnecker joins us now to explain how the cuts is going to specifically impact these families. Emily?
The cuts are part of FSSA's plan to make up some of its $1 billion shortfall to its Medicaid budget. The agency says $300 million of that would come by cutting a program that pays parents of special needs kids to take care of them at home.
Our kids matter. My kids matter.
They're raising their voices for children, many of whom can't do it themselves.
Somebody needs to stand up for those who don't have a voice. Most of these kids are nonverbal.
That's the case for Renee Case's 6-year-old daughter, Ivy, born with a rare genetic disorder.
She cannot sit, stand, walk, do anything on her own. She cannot dress herself. She cannot feed herself. Her vision is not the greatest either. She's nonverbal, so she can't communicate. So yeah, she requires 24/7 care.
Since 2022, Case and many of the parents who came to the Statehouse are part of the state's attendant care program. It allows parents of children with special needs like Ashley Clevin to be paid hourly for the care they give their child at home.
It's been a blessing to be able to help provide a little bit for our family by being able to be home with him.
Clevin is talking about her 5-year-old son Riker, who was born with cerebral palsy. Now FSSA is proposing by July 1st ending payments to parent caregivers to make up for that Medicaid budget shortfall. The plan eliminates parents as an option to be a paid caregiver for their medically complex child. Other medical professionals like nurses would qualify as an attendant caregiver, but families know there's a shortage of those caregivers available to help.
Something that's already a struggle for him in his life doesn't need to include whether or not his mother can be his caregiver or not, a paid caregiver or not.
They are hoping that we won't be able to find somebody to take over our spot so that then they don't have to pay for it.
On its website, FSSA says it's been working to figure out what caused the unexpected increase in Medicaid expenses that led to the financial shortfall, much of which are in the area that the attendant care program is part of. FSSA says on its website we must now move to a service model that aligns with allowable waiver practices, is more financially sustainable, and also better recognizes support needs of caregivers. The website doesn't indicate how many families could be impacted by the cuts.
Because it's all about numbers. They aren't looking at the lives that it's affecting.
Many of those parents were hoping these cuts could be paused as part of a House bill. That bill never made it to the floor. Parents are still hoping language in that now dead bill will be added to a Senate bill in the second half of session. At the Statehouse, Emily Longnecker, 13 News.